And, I talked about, this is one reason I'm so passionate is because, tracing our origin and tracing the source of intelligence. And these are, that's who we came from. And the reason that we do age, well, a significant part is because we're running out of stem cells. So if you're just looking at us when we're born, every 1 in 10,000 cells is an MSC. So these mesenchymal stem cells, I'll talk just a little bit about what they are. But when we reach our teenage years, it's already 1 in 100,000, so tenfold less. And then when we reach our 40s, it becomes 1 in 400,000. In our 80s, 1 in 2 million. So you're literally running out of these engines that's helping you to regenerate. And so there's this graph of the drastic decline as we age. So even though you're just reaching teenage years, but your body has dramatically less regenerative capabilities. So these are MICs. What they are is that these cells are everywhere along your blood vessels. Anywhere you have blood supply, which is everywhere, you will have these cells that are huddling around the blood vessels. So you're looking at them, I think of them like geckos, they're hugging the blood vessels. So what they're doing, you see all those tentacles, all these feet, they are sensing what's going on in the blood. So they're able to sense if there's inflammation going on somewhere, is the immune system trying to send signals, hormones. They're trying to figure out, having the pulse on your systemic condition. But they also have all these, I guess, tentacles. They can also sense what's going on in the neighborhood. So they have communication with neighboring cells, with neighboring stem cells. They can talk to local stem cells. If needed, they can tell the local stem cells, hey, you need to divide. You need to make me new tissue. So they don't themselves rarely to become new tissue. This is why it's a fundamental difference in the stem cell therapy, that we're not relying on these cells' ability to form new cells and new tissue. We're counting their ability to coordinate this regeneration. So that's why, I call them the master of regeneration, that they're kind of the conductor in the symphony of regeneration. And these are just what they look like. The fact that they are so important in the whole signaling of regeneration. This is why the doctor who discovered these cells, Dr. Arnold Kaplan, he wanted to change the name of these cells. He was like, stop calling them stem cells. These are a whole different category. He wants to change them to be medicinal signaling cells, because we've seen that's how they conduct their work, is by monitoring and sending signals. So how do they work? So these MSCs, first of all, they're highly anti-inflammatory. That's one of the benefits, not only, supported by a lot of research, but also from me, just seeing patients. I have drastic anti-inflammatory effects, sometimes really fast. Just give you a couple of examples. For example, one time I treated a liver cirrhosis patient, and he was in hospice, so he didn't have much longer to live. He had huge ascites, swollen. And I give him one injection. On his way back to Sacramento, on the drive back, his brother told us, oh my God, my brother's the swelling in the abdomen has gone down a lot. This is just on the drive back, right? Within hours. These are the fast anti-inflammatory effect. Another patient who had rheumatoid arthritis, wonderful lady, surgical technician, and she couldn't work because she couldn't even make a fist. And when I was giving her stem cell infusion, in the middle of the infusion, because the infusion probably takes about 45 minutes, in the middle of the infusion, and she did this, and she started crying. She said, I haven't been able to make a fist for 2 months. And she just started crying. And there's another patient that's really interesting. She had Alzheimer's in her 60s. She's very severely, demented, and really didn't know even who her husband was. And so she stopped feeding herself for a couple months. So she may be hungry, but she would just sit in front of a plate of food, and she wouldn't touch a knife and fork. She couldn't feed herself. And I gave her stem cell treatment. The next day, so the husband told me later that they put a plate of food in front of her, and she picked up a knife and fork and just ate. And her husband was like looking at her like this, and she would be like, what's your problem? So, and that to me is this quick anti-inflammatory action of the cells, because what I think of her brain is so inflamed and so jammed up that the cell one cell cannot communicate with another cell. So the signal just doesn't pass through. She may be hungry, but there's absolutely no way to communicate. All of a sudden, when you can clear the pathway and you calm the inflammation, the cells are actually able to communicate. So it just anti-inflammatory effect is really wonderful. And then immune modulatory, which is the shifting of the immune system from a more inflammatory to anti-inflammatory condition state. That's why the for autoimmune conditions is so powerful. I've seen, I mean, I used to have cat allergies and I was, hacking and coughing at night and taking medications. And after stem cell treatment, it's been 6 years. I don't need any any medications. So I've seen, the immune system getting to a more healthy state. The regenerative potential, that's the talking with the local stem cells and telling them to regenerate. So this local effect. And the angiogenic benefits is that it does help you to regenerate and grow new blood vessels, because if we regenerate cells, tissue, if there's no blood supply, it doesn't help you any, right? You need to supply nutrients and remove waste. So the angiogenic potential is very powerful. And another potential way that these cells work is mitochondria transfer. So we all know about mitochondria decline. And what's fascinating is that these stem cells actually can deliver fresh new mitochondria to your cells. It's able to tell that your cell's mitochondria is not doing well. And either it can shoot off mitochondria into the space and the mitochondria can enter, or put mitochondria in a vesicle, and the vesicle will fuse with your own cell that may need the mitochondria. Or establish this nanotubule, and mitochondria can walk across the tubule. So they call these on electron microscopy, can walk across the tubule and get to the recipient cell. So you're rescuing the mitochondria, the energy level of the cells. So it's really powerful. Some people have mitochondria disorders. They've actually shown using stem cells through mitochondria transfer that these people are doing better. Anti-fibrotic properties, very important, because when I'm treating people, like the liver cirrhosis patient, so that patient I treated, within 2 months, his liver function became normal, which was shocking because I just gave him one infusion. I did not anticipate that because I told him to come back in a couple of weeks, and he didn't come back, and I didn't know what happened to him. And then I found out that he was doing fantastic. So sometimes you just have these amazing results. And liver cirrhosis is a fibrotic disease, right? Your liver is cirrhosing. It's hardening, and it is losing cells. So it's able to break down the scar tissue. And same for COPD. I love treating COPD patients because it's so easy. The first, when I give people stem cells through intravenous route, the first place they go to is the lungs. And if you have lung problems and a lot of inflammation going on, a lot of cells are going to stay there and try to fix it for you. So this is another reason that we may need different waves of cells, because if you have a lot of inflammation all over your body, if you have this number of cells and you get into the body to fix that amount of inflammation, that amount of inflammation may end up kill some of the cells, because inflammation is toxic to not only your own cells, but also to the stem cells that's given to you. So you may end up fighting the condition, but you're losing some of the cells in the process, right? They're sacrificing the fight for you. So there's only so much, you're only giving so many cells in one infusion, and you may need a second wave for further repair. And then anti-apoptotic properties, really interesting. So let's say somebody has a stroke, and not only the area that's blood is cut off, that becomes dead tissue, right? That's the stroke center. But the neighboring cells somehow are going on and become dead pretty soon because of this cascade of chemical reactions, this calcium cascade, and these cells ended up dying. So they're going on programmed cell death, even though they don't have to, but stem cells can come in and rescue. So you can imagine radiation therapy or crush injuries, things of that nature. When neighboring cells may die, the stem cells are able to rescue them. On the other hand, they also have pro-apoptotic. So apoptosis is programmed cell death, right? So pro-apoptotic, that means pro-death. So these happens when you have senescent cells or cancer cells. So when the cells are, dysfunctional, when they don't belong, these mesenchymal stem cells are able to tell that they shouldn't be there, and they will send the signal to trigger them into programmed cell death. So senescent cells is not just not working, not doing anything good for you. They're actively toxic. They secrete things that cause damage to your neighboring cells. So when you remove them, that's why people can have such great recovery, is because you're removing the dysfunctional cells. And of course, the cancer cells. So stem cells have been used in cancer treatment, has been shown good results, but I'll talk a little bit about that later. There's some nuances. And then antimicrobial. So these MSCs have been shown to have direct antimicrobial properties, so they can actually secrete antimicrobial peptides.